Good afternoon. I think by the time we are done today, healthcare will be completely and permanently fixed, and we won't have any issues. So we got a couple of hours to tell you about what I'm doing, because I think by 5 o'clock we'll have all the solutions. But joking aside, my background, I have been in healthcare. I'm the guy you love to hate. I was an insurance company CIO for a major Blue Cross Blue Shield, and I worked for Medicare and Medicaid, and implemented various healthcare policies for President Bush and President Obama. So being very involved in healthcare all my life. I was very proud of the big fancy systems I used to own and build, with big blinking lights and massive checks we wrote. But in the end, when my son got ill about a year ago, with all my Rolodex and CEOs on tap, I still have the same problem everybody else has: coordinating care, getting the eligibility done, getting scheduling done, making sure everybody's in sync with each other, figuring out how many EOBs we're going to get before I write the check, and on and on and on. And my wife does nothing more than coordinate the care of 1 3-year-old. It really forced a reckoning of, is this centralized model of plan selection, enrollment, eligibility, pre-authorization, adjudication, billing, EOB, payment, and utilization management that we are so fond of, does it really work? And the answer is it doesn't. It doesn't work for most people, including the insurance company. Surprise, surprise, nobody on the insurance company side also likes the processes that we have in place today, but that's the processes we got, so you gotta live with them. So I decided to leave my fancy perch and start a company on blockchain that would allow me to decentralize processes that I was very proudly centralized around. So essentially, what is Solve.care doing? 3 things we don't do. We're not a medical records on blockchain. Others will solve that problem. Good luck, and I hope you succeed. We are not doing an integration framework where everybody will magically connect with each other and we'll have another blockchain-centric health information exchange that the data will fly. That's not. Oh, okay. Better? We're not doing a health information exchange on blockchain. We're not doing medical records on blockchain. We're not trying to do clinical trials or patient-submitted data on blockchain. What we're doing is the back plumbing of healthcare, which is administrative and financial. So what do we really do? So about a year and a half ago, I bought a software company in Ukraine to build a blockchain solution for things like, how do I select a provider? How do I do direct scheduling? How do I share my eligibility data? How do I get pre-authorization done without having to call the insurance platform? How do I get billing done and reconcile it with direct payment tokens? So what we are really doing is building a healthcare payment and administration platform that a patient can use to directly interact with the provider with delegated authority from me, the insurance company. I don't want you to call me. I don't want you to access my call center, my eligibility center, my adjudication system. I want to give you the delegated authority to go see whoever you want, and if that doctor accepts my token, then I'll pay them what I promised to pay them. Dramatically changes access to care, reduces tremendous amount of cost and friction, and stops me from being the bad guy, because I really never want to be the policeman of care, but I've become so. I really want to be the facilitator of care. My job is to manage, not to prevent care, because look, it's not in my interest to have you be sick, because if you get sicker, I write a bigger check. So unlike popular wisdom, insurance isn't out to make you sicker. It's out to get you well faster. But it wants to prevent abuse. It wants to prevent overutilization. So that's our mission. We are not an insurance platform, but we are a platform on which insurance companies can decentralize processes that are very difficult for patients and providers. So there are really 3 parts to the platform. We built it on a blockchain. We didn't decide after we had a platform, let's plug in blockchain. I couldn't do what I do today without blockchain, because I need a decentralized ledger to even conceive of an idea of an eligibility token that you can carry in your wallet and show to any provider. I could not conceive of non-contracted providers getting paid without some kind of a distributed ledger. So we're talking about fundamental use of blockchain in a way that we can administer healthcare differently. On top of that ledger, which is called our Care Ledger, we built an application called Care Wallet, which there are 3 flavors of it: patient wallet, physician wallet, and administrative wallet. And that wallet has specific cards that you have a reason to have in your wallet. As a patient, you have an eligibility card. As a patient, you have an appointment card. As a patient, you may have a referral card, a prescription card. But as an administrator, I have a utilization card. I have a premium card, and so on. And a physician has equivalent cards in their wallet. These cards operate on the chain. So I don't need to have you calling me and checking what's your copay, what's your deductible, what's your coinsurance, who's in the network, who's not in the network. My goodness, I'm already sick of it. So that's the idea, that why am I doing all this stuff that pisses you off I have to do it, and everybody hates each other. Let's actually decentralize functions that impede care. Our clients are insurance companies. Yes, the big bad blues, my former employers, they are the clients, the Humana, the Cigna, the United. They are all interested in doing what we are proposing. You just have to go to LinkedIn and listen to the Humana CEO, and he basically is going to tell you exactly what I'm telling you, that this model needs to be changed, and that's what we're after. But then, fundamentally, we are also after direct payment to provider. The providers hate the idea that they deliver care to you, and then I pay them 97 days later, and they don't know how much they're going to get paid. Really? How is that supposed to make my provider excited about taking care of my patients? So we are trying to think of a model and decentralizing payments, making them real time, so 92% of the claims in the US actually don't need to be adjudicated. They could be real-time payment. And the benefit to the provider is that they can see you and they know how much they're going to get paid and get paid real time in a care coin and redeem them at their will. And why do I want to do that? Because it saves me a tremendous amount of adjudication dollars. As an insurance company, I don't get any medals for spending money on adjudication. So it's essentially about decentralizing healthcare for the benefit of all. At the heart of it is a care wallet, which has 4 types of cards. The care wallet is clinical, administrative, financial, and technical. Clinical cards are things like self-care management for chronic diseases and preventative care and so on, smoking, diabetes, and so on. On the administrative side, we have cards for eligibility, enrollment, referral, payment, prescription. The financial side is essentially making sure that I'm paying out of pocket what I should pay, and I'm paying the rest out of my wallet in care coins. And the technical is the essential integration, if I need to have integration with the back end, but not clinical. We're not about clinical data on our chain. I'm going to skip the video in the interest of time, but it is on our website if you would like to go see it. So let me jump straight to the type of functions we are talking about. These are the type of clients we have on the left. That's our institutions who we plan to sell to. Adoption isn't voluntary. Adoption is mandated. When I'm an insurance company and I have a provider network, providers are my contractors. I tell them to use a care wallet, they have to use it. It's not voluntary. It's not like, oh, please use the wallet. It's like, use the wallet so you can get paid real time. Same is true for patients or insured. Instead of mailing you a plastic card, which says your BIN number, your RX number, your group number, I'm going to send you a care wallet and give you a real-time eligibility card so you can actually query the wallet and say, what's my deductible today? So you don't have to carry on the dumb plastic that's always out of sync with the reality of and you don't have to call my back call center. So these are the companies that we are focused on sponsoring our network, or rather using our network to sponsor healthcare, and the right side is the functions that they can automate using our platform, right? Let's move to what we are doing today. So the big innovation of our platform is 2 types of tokens. One is a payment token called CareCoin. CareCoin is not traded on the exchanges. It's not variable value. It's a stable value payment token that I issue into your wallet so you can pay the provider. And the provider has guaranteed redemption value. It can also have variable performance value. If the provider takes good care of you, gets you out of the hospital 3 days faster, and makes sure that you don't have a relapse and get readmitted, they get a variable dollar. But they know the base dollar the moment they see you, right? It's a guaranteed payment token. It's backed by my reserves. There is no fluctuation in the value. Redemption value of a dollar coin is always going to be $1. It may become $1.10 because you are such a good provider, but it won't become 99 cents. The care coin only operates with the benefit of a gas coin or utility coin called CAN, Care Administration Network Token. So the more care coins that circulate, the more CAN tokens are needed. And that's where the free trading comes in. The CAN token is what investors, clients, institutional or non-institutional people can buy and hold, and that's what they will trade in the market. And if I'm trading 1 billion care coins in the market because Blue Cross ABC wants to issue payments on care coin, I need 1 million CAN tokens. But if I have 100 billion on the care coin, then I need that many more CAN tokens. Same is true for more care wallet users. If you want to pay for your care wallet subscription because your employer doesn't pay for it, or your cards, and so on and so forth. So as our platform grows in adoption, as more care wallets get issued, as more care coins circulate, as more care cards are being utilized, CAN token is fueling all that, like ether gas, same idea. Clear? Now, what I want to make sure is that you understand, care coins are unlimited. If you have $1 trillion, as some insurance companies indeed do in reserves, you can issue 1 trillion care coins. Nobody stops you from doing that. It's what you pay out in healthcare each year. US spend in healthcare is $3,700 billion, about $3,100 billion is actual provider and hospital payments. So that's the number of care coins we would expect eventually if we got 100% penetration. We won't get 100% penetration, but we have a massive market to play with. Now, moving to, we've been in business for about 18 months. I started the company with my own seed money. I've invested several $1 million into building the platform. We signed a major client in November, and that's when we started our token sale. So we are a post-client, post-revenue company, but with a single major client in the US who is issuing a Care wallet to 5,000 plus physicians and paying them in Care coins starting May. So this is a very large launch in one of the US states, followed by 17 other states that we are pursuing. We are doing a pre-sale right now. Our pre-sale ends in a few days. We are raising a total of $45 million to fund the expansion worldwide. We are moving into Netherlands and Belgium and France after the US, where there is a capitated insurance model in place. And then we are looking at markets like Brazil, China, and so on. Anywhere where we have a third-party payment model in the US, that's where we are going. So we are doing a $10 million pre-sale, which ends in a few days. And then 30 days later, we are doing our token sale on February 21. The total amount of money we're looking to raise is $45 million, out of which we've raised about $7, and the rest is to come. And what we are selling is a utility token, right? We are selling the CAN utility token. That's the gas for the platform. So what you're buying is adoption of our platform. You're buying the fact that insurance companies will use CareCoin to pay providers, and to run the CareCoin through the platform, they need to pay us in the utility token. The gas, the fuel of the platform is what you're acquiring. A little bit history about us. I have some very big names on my board for a reason. Former Congressman James Moran, he's on my board as an advisor. So is Secretary Upson, who was a Secretary of Technology for Virginia. Director Bowling, who ran Medicaid for West Virginia, on and on and on. We have very big luminaries from government on the board. Why government? Because Medicare, Medicaid, CHIP, SNAP, TANF, similar challenges in China, in Brazil, in India, they require public policy experience. We can sell to commercial insurance all day long. That's me in my old avatar. But to get to government and make sure that they use our coins is something we are planning for a year or two down the road. Final statement is that this is a global platform. Care cards will be localized to every country. It is not my job to build a care card for Brazil. It is not my job to build a care card for China. The local partners will build it. But the platform, the framework, and the capability of the Care protocol is our job. So Foundation is focused on launching a global platform that anybody can use. But in the US, we are our own implementers. Outside the US, we are looking for partners. And that's how we're going to Netherlands, France, and Belgium as the next step. I'll be at the booth. If you have any questions, I would love to have you come by, critique us, tell us what we're not doing right. I would love to hear any feedback you have. Or join our Telegram community if you have the cycles. Solve.care is the name of the community. And have a wonderful rest of the day. Thank you, everyone.